Hi everyone. So you all are here back for the next topic of discussion, that is disability evaluation certification. So what does the topic exactly mean? Although we wrote a lot under the heading and everything that this is this and that, what I want to elaborate what that exactly is. So talking about disability evaluation certification, all of us, be it physical therapist, occupational therapist, social worker, NGOs, government agencies, government officials, everyone. All of us need to know about how a disability certificate is made, who makes them, how to get that made, and especially on the medical aspect, what all things we need to consider, how to assess the disability of an individual. So all these things we'll be covering in this discussion that's going on right now. And yes, so the main thing we'll be discussing is the physical component of the disability. So for that thing you must be knowing that what disability exactly is. Disability, if we break the word disability, so dis means disturbed or hampered, and ability means the potential to do something. So hampered potential to do something, that the individual is not able to do the thing that is expected from his or her role in the society or as an individual. When talking about disability, if we take the WHO, that is World Health Organization's data, more than 1 billion people are affected with some or the other form of disability. And because of that thing, like almost 15% of the population around the globe is affected because of this disability thing. So we need to be very much considerate that how to tackle with these things and how to actually assess people with disability, because an early assessment will lead to lesser disability and a better outcome in the near future. So before proceeding further into the term disability and how to deal with it and how to assess it, I would like to tell you some terms which you will be listening every other day, all the day round and every other day, whenever you will be working with some, organization that is doing assessment of people with disability, because everyone doesn't do that. Second thing, the government doesn't give anyone the authority to conduct a disability examination. So there are certain units who are responsible for carrying out this evaluation, and for this thing, who all are responsible for assessment of disability. Talking about the people who are involved in this thing, so we have the chief medical officer, that is should be a physician. Second thing is physiotherapist or physical medicine and rehab specialist. Third thing is occupational therapist, who deals with the other individuals like other autism spectrum disorders and all those assessments. And then we have many other individuals who are involved in it. So talking about what all things are considered disability, how this thing proceeds. So we have, if we take the data all around the globe, more than more females are involved than the males. Second thing is the poor countries, that is the low income and the middle income countries, are more involved than the high income countries. That means the number of disabled are more in the low and middle income countries. Why so? And yes, one more thing, it's more in the rural areas than the urban areas. So these things like low income countries, rural areas, why this thing is happening, like why there's more disabled individuals present in these areas rather than the other ones? Because it is because of the infrastructure, the lack of and accessibility of resources, the lack of monetary aspect. So money is also lacking somewhere or the other. So that is leading to this, disparity between the rich and the poor. So disability, why we need to, discuss about this thing? It's all about whenever we discuss about disability, we mean that something that is not, desired is happening, and we need to help them out in the best possible way to fetch the maximum benefit out of it. So disability is a vicious cycle. It starts with one thing and then ends up to another. In the Person with Disability Act 1996, the government of India, decided that yes, PWD Act or the Person with Disability Act will be giving individuals who are disabled a particular, allowances along with special concession in travel whenever they travel somewhere, or is there some government job, or is it some college admission, they'll be getting concession because they are considered not as equally competent enough as the other ones. On one aspect they will be competent, no doubt in that, but yes, we need to take them with us at every point of time to make them eligible for everything, because they are suffering from some issue, so we need to consider that as well while assessing them. So that is why these Person with Disability Act was framed in 1996, and there was an amendment that was made 4 years back, that is in 2016. So why was this act made? Because there are so many disorders, like let's say I will take some examples, I'll make this session very basic so that everyone can understand what it is. Let us take an example of diabetes. So if a person is suffering from diabetes, that is a disease, and if their diabetes is long standing, that leads to neuropathy in the distal, like hands and legs, or foot gets neuropathy, that is called peripheral neuropathy, because of long standing diabetes and ketone bodies. So that leads to altered sensation, the person is not able to sense. Okay, so that leads to disability. So that is also counted as disability. A person who is having, let's say, leprosy. Okay, in case of leprosy, what happens is the nerves are involved. The bacteria, okay, that enters the nerves and affects them, so thereby hampering the nerve conduction and leading to peripheral nerve involvement, and ultimately the person who are cured from leprosy are considered under disability continuum, in order to provide them the much needed facilities and the things which they are not able to otherwise do with the help of those amenities. Talking about what all disabilities do we consider and what all terms are important in terms of disability. Before moving on to actual assessment of a patient with disability, you should be knowing the terms that are important in that aspect. So WHO classifies disability into multiple continuums. So we have, if taking the basics, we have anatomy, we have physiology, and then the disease. So anatomy and physiology. Anatomy means how a person looks, the structure of the body. Physiology means how the body works. Okay, so that is the normal thing. Now, when anatomy and physiology are going perfectly, they are not altered, they lead to activity. So a person with anatomy and physiology in harmony performs the activities of daily living easily, and they move on to the next stages, that is, when they do the activity, they are performing their function as an individual, like daily bathing, dressing, getting up in the morning, washing, cleaning, everything, right? And as soon as, so this was individual function. So I am an individual, I have many roles to myself. I want to pursue this thing, I want to bathe, I want to brush, I want to do this thing. But next level of individual is society. Many individuals meet to bring about a society. So individual has a significant role in their society as well. I am a son, I am a brother, I am a friend, cousin, or maybe I have many roles in the society to different people, right? Now, to perform those roles, I should be able to do my daily activities, like I should be able to perform my individual roles for myself, then only I can move on to a society to help other people out or to interact with them in a positive manner. When now this role making, this societal component when comes into action, then we move to the economy and mental health well-being. So because we know what is health, can anyone describe the basic components of health? What all things are involved in health according to the WHO definition? Yes, I'm asking from you people. What is health in 3 words? Health is this, this, and this. Can you please tell me what health is? Yes. Yeah, perfect. Going great. And health is? Health is wealth. Yeah, health is wealth, but what else is health? Alright. So let me tell you. According to the WHO definition of health, health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. That means if a person is not having a disease, or if a person is disease free, will not call them healthy, because not being a diseased person means you are fit, physically fit. But physically fit means just physical component of health. We have two other components, that is mental health and social health. So when an individual is having proper anatomy, proper physiology, they are doing their day-to-day activities, individual roles, and that is why they are able to do their societal roles. So society is happy with them, they are happy with the society, they are contributing equally. So that leads to the social component of health. And when this happens, you have friends, you have family, you have many roles to play, then it leads to ultimately emotional satisfaction, and that is what we call the emotional aspect of health. So physical, mental, and social well-being. Now when talking about disability, so are we talking negatively about disability? Not at all, because we are not negatively influencing it. We are just bringing into consideration that we should be much considerate about why we are talking about disability, because these roles, these individual things which I told you, they are not able to perform. So we need to take them up to the upfront to help them out in the things they are not able to do, so that they can work up with us what we exactly want to. So how the thing change in case of disability? So anatomy and physiology. Anatomy means bodily structure. So let's say I'll explain everything with examples so that you can get everything, you can connect the things. So anatomy. Now if anatomy is altered or hampered, what happens is, how can anatomy be hampered? If someone gets an accident, okay, and that leads to partial disablement, partial loss of some part of the body. Let's say someone met an accident and lost his leg in that accident, okay. So now he is not having that anatomical thing. Anatomy means that leg is not present, that means anatomy is not present. Now physiology, someone is having leprosy, okay, due to that their distal nerves are not giving them proper sensation, the sensation loss is there, so that is leading to improper physiology. So anatomy, physiology disturbed. Another example of anatomy may be you have a person with diabetic neuropathy, and then we have to cut that limb. Or if a person is having gangrene and we had to cut that limb to amputate that part. So a person who is having amputation is also considered under the disability thing. Okay. Now this anatomy is disturbed, physiology is disturbed. Because of these issues, the person is not able to do his activities of daily living. Now ADLs, if you are in first year or second year of BPT, you will be reading in your further classes that ADLs, activities of daily living. So in ADLs you have various types of ADLs. You have IADLs, okay, that is instrumental activities of daily living. So the basic things you need to perform daily, right? Then AADLs, advanced activities of daily living, okay. So these activities of daily living, if performed properly, will lead to function. But because they are not able to perform their function, because they are not able to do the activities, so that function is hampered, so that leads to functional limitations, okay. So injury leads to that particular disease or disablement or issue in the anatomy and physiology. leading to activity limitation, leading to functional limitation, leading to, now because they are limited functionally, they are not able to perform their function, so that leads to participation restriction. They are not able to participate in that activity. So if a person is not having the limb, so he or she is not able to participate in certain societal roles, maybe running or jumping or doing some activities. So that leads to participation restriction, and when participation restriction ensues, that leads to disability. So this was a continuum of injury, disease, activity limitation, participation restriction, ultimately leading to disability. And this is a vicious cycle. Now, this thing, whichever I told you, this injury, this and that particular level of continuum, we call it ICF model of disability, right? So in 1980, it was made by WHO, right? What happened that ICIDH, there was a model that was introduced for this particular thing which I told you. The whole story was about ICIDH, International Classification of Injury, Disability and Health. Sorry, handicap. I would like to correct myself. It's handicap, right? So that one. And in 1980 it was introduced, and then in 2000, May 2000, it was reintroduced, reframed, and the name was changed to, from ICIDH, it was changed to ICF, that is International Classification of Functioning, Disability and Handicap, right? So it was changed and some new things were introduced. So this was the new criteria, that is injury, activity limitation, participation restriction and functional limitations leading to disability. Now, how much disability should be present and what sort of disability should be present, that we should call it actual disability, and we should consider that. So what all disabilities are there? So one can be having physical disability, or we call it locomotor disability. Locomotor, what is locomotor or locomotion? It's movement. Movement means your gait pattern, the way you walk, the walking pattern. So if someone is amputee, who has undergone amputation, if someone is lacking, like someone who would have gone some sort of neuro issue, maybe multiple sclerosis or motor neuron disease, who are not able to walk, so they are considered under the, or maybe stroke, so complete paralysis of the lower limb if happens, that leads to consideration under the locomotor disability. Second thing is, we have the other component, that is the mental disorders. We have mental retardation, autism spectrum disorders. Okay, this was one more thing. So in 1996 PWD Act, which I told you, in that one the people with disability, dyslexia and all things were not included, but in 2016 autism spectrum disorder was included, and mental health issues were also undertaken into disability. So apart from these things, we have, so physical is locomotor, mental is mental retardation and all those issues, so mental disability. Third is cardiovascular disability, cardiopulmonary disability. So if someone is hampered on the cardiac part, so what happens is they are not able to do vigorous activities, and if that limitation is so much that they are not able to do their day-to-day activities as well, so that is classified as cardiovascular disability. Then comes their learning disorders, their other components, that is like if they are not able to see, so that is visual impairment. So visual disability is another component that is also there. Okay, so there are certain criteria that it should be this much percentage of loss, then we will consider it as visual or locomotor or mental, or there's one more, that is hearing disability. So if someone is not able to hear something, okay, so that is also considered as disability. But it is not like everyone who is lacking of some sort of audibility, or they are not able to listen to something, they are considered as deaf and dumb, they are not able to speak, oral issues. So these things are considered as disability. Now there is certain percentage. For to be considered as a locomotor disability individual, one should at least be having 40% of disability. Okay, and 40% of disability means there is a proper assessment. We'll be considering taking that into consideration in a short while. We'll be conducting the complete assessment in front of you, and that assessment will take into consideration how to assess that thing. And if the issue or disability is more than 40%, the individual is not able to perform more than 40% of the activities, will mark them as having a locomotor disability. Likewise, in case of mental retardation, we have 30 to 40% of hampered issues or involvement is considered as mental component or mental disability. Likewise, for hearing, we have, if it is more than 60 decibels or above, they are not able to hear, then it is considered as hearing disability. Okay. For vision impairment is considered when it is more than 90% of blindness or 90% of vision loss, then we consider it as complete blindness and complete disability. So this was about the percentage and how we judge them. Now comes to who makes the certificate, how to get it done. Afterwards we'll come to the assessment of the individuals with disability. So on part of who makes the certificate, there is a complete team of individuals who are involved in this. We have ophthalmic surgeon for eyes, we have ENT specialist for deaf and dumb, we have PMR specialist or physical medicine rehab specialist or a physical therapist along with him to assess the component of locomotor disability, along with a general physician who's having core duty as a chief medical officer. They'll be assessing the and then giving them the certificates for the same. Now how the evaluation is done and what all criteria are there. So for that thing, we'll be taking the criteria in such a manner that first and foremost, being it's a big topic and cannot be covered in a single session. But yes, so we'll be covering the upper limb in this session. Then we'll be covering the lower limb, trunk in the coming sessions. Okay. So for this session, Dr. Karishma Chawla will be now covering the component of the upper limb assessment and locomotor disabilities. So we'll be primarily focusing on the locomotor disabilities because those ones are in our domain and we are the best persons who should be knowing actually what it is and how it is gonna be done. Because many of you are gonna do their clinical practice and many of you are gonna go in government hospitals, and the government hospitals are the main focus areas who are involved in this particular continuum. They are the ones who guide the patients with disability to make the certification and do the assessment and everything. So you'll get the opportunity to work with these people and work for them and help them in evaluating the disability. So you must be well aware. So watch the video till the end and you should grab it as much as possible. If you get any doubt in between, feel free to ask in the comment section. Live chat is going on, you can ask us any question you want. And yes, one more thing I would like to ask you, you people can let us know which else other topics you want us to cover in the future discussions, and you can just write in the chat box. Okay, so hope you like this thing. And now I would like to welcome Dr. Karishma Chawla. She would be covering the topic of the locomotor disability evaluation. So all the best, see you there, stay tuned, take care.